All right, hello everybody. I'm Dr. Andrew Choi. I'm an associate professor at George Washington University and director of cardiac MRI program, and also a researcher in artificial intelligence and imaging. It's really my honor and privilege to be joined today by Dr. Tim Leiner, who is a tenured professor of radiology at Utrecht University in the Netherlands. He's one of the leading cardiac MR clinical investigators in the field, particularly with regard to artificial intelligence, and a recent member of the CMR Board of Trustees. And we're here to discuss his session that will encompass and discuss AI and CMR at the upcoming CMR 2021 session. So, Dr. Leiner, it's a privilege to be joined by you today.
Thank you for having me, Andrew.
So, Dr. Leiner, can you, as we talk about the role of AI and CMR, I'd just love to get your very bird's eye view on, what's been important as far as recent developments in the field this past year.
Yeah, well, that's an excellent question. And I think what we've seen is a number of vendors coming out with products that we can really use in clinical practice for quantifying cardiac function. Not only in CMR, but also in other modalities like ultrasound. And I think that's tremendously helpful to practicing clinicians to speed up the workflow and the analysis of the cardiac MR scans they make and interpret. But I think if we look a little bit further into the future, there's been really nice work that came out in the past, let's say, months and year that shows benefits of using AI in CMR reconstruction, so image creation, if you will, from the raw data. And I think there's an opportunity there to really get another factor of speed up in the acquisition process. So this nicely complements, let's say, the image analysis tools we have right now, or that are slowly trickling into clinical practice. And of course, these algorithms have to be validated that involve image creation, but I think that's a matter of time. But I'm particularly impressed with that type of work because it will offer additional speed gains that we can use to get faster examinations. Or, for instance, if you want to get higher spatial resolution in the same imaging time, that's also an option. So.
That's a really great point. And one of the important roles is how can we improve our clinical workflow and how can some of these AI processes do that? And as you, Dr. Leiner, will be one of the featured speakers on Friday at 11:45. It's this session entitled Emerging CMR Methods, Acquisition and Reconstruction. Can you tell us a little bit about your talk? Because as a practicing clinician, we often wonder, how do we really adjudicate these new AI technologies, and what should we look for? How do we think about validity? And I know this is an area of your expertise.
Yeah, thanks. So another great question. And what you see when you go to PubMed or Archive or other websites that have literature on them regarding machine learning and medical software and medical applications, what you see is a tremendous amount of papers every day almost coming out with new algorithms. And one of the things I ask myself always is what can I use in my practice? And many things should be viewed as, I think, more of a proof of concept or an exploration of an idea. Where can this go? But so I noticed that more people were struggling with asking themselves, is this useful for my practice? And this development that people made in their lab, can I apply that in my lab or in my patient population? And in order to address this in a, let's say, structured manner, we got together with a bunch of people interested in this topic, as well as representatives from a variety of different societies, among them people from CMR. And we tried to come up with a framework on how to judge the new algorithms that are coming out, and also to help people think about how they can start developing things.
Mm.
So it's a two-pronged, let's say, approach that I want to discuss. So when you have an idea, how can you start thinking about implementing this and involving the right people to make the algorithm? And if you read a paper about an algorithm, or if you want to validate your algorithm, what are the things that you should look at? Because I think we should be critical and have a high bar for the things that we try to bring to clinical practice. They should work well in a variety of patients. So that's sort of the content of my talk. So.
I think it's a really important topic, and you think about really following the steps for validity and for establishing a good ground truth, because we do want these technologies to be better than what we have already in clinical practice. And so I really encourage our viewers here to attend this session, to read Dr. Leiner's paper on establishing and really adjudicating the methodologies, because I think there's really good information there. We have just a little bit of time left. I want to just ask you also, for our viewers that include emerging researchers, clinicians, trainees, fellows and residents, what's one piece of advice that you have for them, either in for clinical CMR or within AI and CMR?
Yeah, well, to start with the last topic, I would advise people who want to get involved in this field, find a partner on the technical side, in computer science or in image processing, and talk to these people. And you'll be surprised that most of them want to talk to you as well, because as doctors, we bring domain knowledge to the table, which is very important when designing algorithms and also validating them. And there are a lot of people these days who have the expertise to create algorithms, and in my experience, they're looking for clinical partners to develop it in exactly the right way that fills the clinical needs we have. So my advice would be to team up with those people and pick a good problem to work on and get to work. And obviously, there are many of those people at SCMR attending the sessions, and so that's a great start, I think. Just reach out to them. I did the same thing when I started in this field. I reached out to technical people, and it evolved into a very pleasant collaboration. And so just ask them to work with you on things, and you'll be surprised to see what they say. So.
That's excellent advice, Dr. Leiner. Finding a technical collaborator is so crucial in this work. And as we conclude this time, what's one piece of advice you have for perhaps a really early career or trainees on how to get more involved with the SCMR as an outgoing, just as a recent member of the board?
Yeah. So let people know you're interested in joining committees and doing work for the society. Get involved, talk to people, committee chairs, send emails to the leadership of the society indicating that you want to get involved. So we can use the help of bright young people. There's always enough work to do. So step forward and let people know you're interested.
That's great advice, and just really having to express your interest is so crucial. So Dr. Leiner, I really thank you for your time, for your insights. I encourage everybody to attend Dr. Leiner's talk on Friday, February 19th from 11:45 a.m. On emerging CMR methods. And I think it will be one of the highlights of this SCMR 2021 meeting. And we encourage everybody to join SCMR 2021, precise, predictive, personal, online this year and virtual. We hope you're all well. Thank you for joining us today, and thank you, Dr. Leiner.
Thanks for having me, Andrew, and see you online.